Hi, it's Mrs. Hall. This will be your day one lecture for personality disorders in 114 BC. Okay, what is personality? That's where we have to begin if we're going to talk about personality disorders. So, personality is the totality of emotional and behavioral characteristics that are particular to a specific person and that remain somewhat stable and predictable over time. So, this is the style that a person adopts to deal with the world, and their peculiarities that all people bring into their social relationships. Okay, so personality disorders. Personality disorders occur when the traits that we discuss deviate markedly from the expectations of the individual's cultures. So, personality disorders, those normal traits that are related to all of our social relationships like shyness, seductiveness, rigidity, suspiciousness, and passive aggressions, these are exaggerated and then they become rigid to the point that there is a dysfunction in that personality. Okay, so personality disorder, as defined by the American Psychiatric Association, are these behaviors that become pervasive and inflexible, and they contribute to maladaptive patterns of behavior or impairment, and then these lead to distress. So it's a pattern of inner experiences that deviate, like I said again, from the expectation of what the culture would normally accept. So these occur an onset usually in the adolescence or early adulthood period. They cause distress and lead to an impairment, like I said. Okay, common traits of personality disorders. I've listed a lot here and I'll run through them very quick since we are recording and you may just want to listen to this again. Um, that's avoidance and fear of rejection, blurring of boundary lines, insensitivity to others, demanding, and fault finding. So they find fault in other individuals. They have an inability to trust in relationships and are very suspicious of other individuals. They typically will have passive aggressive traits, and this invokes interpersonal conflict. Usually, they appear to have had some sort of social anxiety in their childhood period. The most common symptoms occurring in personality disorders are the impairment in the interpersonal relationship functions. You'll see this in about 41% of personality disorder diagnoses. And then we have also commonly occurring are dysfunctions in cognition. This will be in about 30%. Their affect is impacted in about 18%, and they have that impulse control in approximately 6% of diagnoses. They do have the chronic low self esteem, and I did mention, but they're inflexible and have maladaptive responses to stress. They have a disability in their working and loving relationships and a capacity to frustrate or get under the skin, quote unquote, of other individuals. Okay, so what is the prevalence and comorbidities of personality disorders? Personality disorders impact 20 to 30% of our population, and 30 to 50% have co-occurring personality disorders. They coexist with what we typically see in depression, panic disorder, anxiety disorders, PTSD, somatization, and impulse control disorders. Nurses are likely to encounter clients with these personality characteristics in all healthcare settings. So nurses should understand normal personality development before they can understand what maladaptive behaviors are. So think about Erikson's theory of development, and when you learned that in fundamentals, the importance of learning what normal development is cues us into what maladaptive development would be. So, theory. The events and sequences that result in the pathology of the personality are very complicated, and they are difficult to unravel, just like this DNA sequence we see here. There are 10 specific types of personality disorders, and they are identified in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or the DSM-5. And you'll hear DSM with a different number when those are just updated versions. So they have derived that there's no single cause of personality disorders. It appears that in the DNA there is a disturbance in the NT5HT and those subtypes. We're not going to go into the entire DNA sequence when we discuss the diagnosis or cause of personality disorders. There's an affective instability with like borderline and personality disorder, and we will go over that later. There seems to be an excessive limbic reactivity in the GABAergic and glutamic cholinergic centers. There are genetic alterations, but there are also psychological influences and then cultural considerations. What might be normal for one culture would appear to be abnormal in another culture. That's why when we discussed it just a few minutes ago, we said what might be abnormal for their culture. So that's why we discuss cultural considerations as part of our theory of personality disorders. Okay, so what are the risks for personality disorder? Number one is chronic trauma. These individuals have typically experienced repeated cycles of trauma, or these are children that live at home where they are experiencing or witnessing domestic violence. This puts them at risk for personality disorders. And then they act out as a result of their past history. They disconnect from their emotions and they develop fears of others, all based upon their chronic trauma that they experienced in those formative years of development. Okay. The current diagnostic system classifies the personality disorders into 3 clusters. And the clusters are made according to the description of the personality traits. So here you will see cluster A, and I've just put odd there, but these are behaviors that are described as odd or eccentric. Cluster A is paranoid, schizophrenia, and schizotypal. And then we have cluster B. Cluster B personality disorders. These are described as behaviors that are dramatic, emotional, or erratic. These are antisocial, borderline, histrionic, and narcissistic. We then have cluster C. Cluster C personality disorders have behaviors that are described as anxious or fearful. These cluster C are avoidant, dependent, or OCD, which is obsessive compulsive disorder. They then have, which is not in a cluster, but it's not categorized, so we have a passive aggressive personality disorder. So I just want to remind you here before I get started on working through the personality disorder clusters that there are chapters or bolded multi-paragraphs that cover each cluster in your textbook. We will close, however, they will be a bit out of order, so don't panic. But I'm going to close the discussion on personality disorders with the two most socially impacting cluster B disorders. Those are antisocial personality disorder and borderline personality disorder. So when I go through the clusters, I don't want you to panic that when I go into B, I automatically am going to move into the other disorders, and then I will go backwards to discuss which two are the most socially impacting cluster B disorders. Okay. All right, so paranoid personality disorder. The symptoms of these are generally mild, but they do interfere with occupational and social functioning. Okay, that is what makes them a disorder. So they have a pervasive distrust and suspiciousness. They suspect that others are exploiting, harming, or deceiving them. They are preoccupied with unjustified doubts about the loyalty or trustworthiness of other individuals. They're very reluctant to confide in others because of this doubt of loyalty. And they read hidden meaning or threats in remarks or events that have happened. They do bear grudges, so they hold a grudge against individuals. They have a lack of forgiveness. They perceive attacks to be on his or her individual character, and they have recurrent unfounded suspicions regarding the fidelity of others. So this is where the pervasive distrust and suspiciousness of other people come in. Paranoid personality disorder usually begins in early adulthood. These individuals are constantly on guard. They're hypervigilant and ready for any real or imagined threat at any time. So they avoid interactions with others and they feel like people are going to take advantage of them. There's a prevalence of about 2 to 4% of the population that have paranoid personality disorder. So this, understand, is not just a simple distrust or suspicion This is a long-standing, pervasive distrust. You might see this become apparent in childhood. A lot of times you're going to see it as a social anxiety exhibited in childhood. They are jealous of individuals and they're very controlling as adults. They have an unwillingness to forgive, like I said, and they project their feelings onto other individuals. So, paranoid personality disorder, what are the guidelines that we as nurses need to think about when we're caring for someone with the paranoid personality disorder? We have to counteract the mistrust that they have. So, what do? We adhere to very strict schedules, right? We don't divert from those. We give them a schedule, and if we say we're going to return to the room in 15 minutes, we return to the room within 15 minutes and not 30. So, we adhere to the schedules. We do avoid being overly friendly because that's just going to aid to the mistrust that they have and the suspiciousness. We use very simple, direct language with the paranoid personality disorder individuals. We do project a neutral but kind affect, but again, we avoid being overly friendly. Okay, so what is the treatment for paranoid personality disorder? We have group therapy sometimes with these individuals is threatening. So we use psychotherapy versus the group therapy. We use anti-anxiety agents such as diazepam and antipsychotics. We use those for the more severe delusions that an individual may experience. And in these situations, we would use haloperidol or Haldol and Pimozide, which ORAP. That's not as frequently used. A lot of times you'll see Haldol used first, and then if there is a need for others, then they can add those. Um, Let me go back to the psychotherapy versus group therapy for a moment. We do see that group therapy can be threatening. However, if you think about it, the group setting can be useful in improving an individual's social skills. The role playing and group feedback can help reduce suspiciousness in some individuals. So, psychotherapy would be your first line treatment, and group therapy could be considered if they had just a moderate impairment in their social skills, and we wanted to try that. Okay, so schizoid personality disorder. This is a primarily profound defect in the ability to form personal relationships. They're often seen as eccentric, isolated, aloof, and lonely. Their discomfort with human interaction is very apparent. A significant number of these individuals are not going to be observed in the clinical setting. Think about an acute diagnosis and admission, recovery, and then discharge. So a lot of them will not be seen in that acute setting. And diagnosis, interestingly enough, is more common in men than in women. The prevalence, however, overall is nearly 5% of the population. Their symptoms or characteristics will appear in childhood and adolescence and then persist. They're loners. They have poor academic performance and an increased prevalence of disordered family life. They do avoid those close relationships and exhibit depersonalization and detachment. All right, schizoid. These individuals are detached from social relationships, and they have a very restricted range of expressing their emotion. Again, it can begin in the early adulthood development stage. They don't want to, nor do they enjoy any close relationships, including with their family members. Their history shows that they engage in primarily solitary activities, or they engage more with animals than they do with people. They are able to invest enormous energy in their intellectual pursuits. Now, that may to you seem like I'm contradicting myself when I say they're not academically successful. They are usually not successful in the academic setting. However, because of their solitary activities, they focus on things they enjoy, and put that energy into the intellectual pursuit of things. They do exhibit little or no spontaneity. They have to really think through things. And their affect is commonly very bland and constricted. Okay, so schizoid personality disorder, let's continue. What are the guidelines for nurses? We have to avoid being too nice or too friendly. And we don't try to increase the socialization of these individuals. We don't push them into social situations where they would be uncomfortable. And we have to assess for symptoms that the patient is very reluctant to discuss. And the example that I provide for you in just a moment will show you what kind of symptoms might be a reluctance to discuss with others. And then you have to protect them against groups' ridicule of them if they are in a group setting. Treatment, we've got psychotherapy and group therapy, and then these individuals, as far as pharmacotherapy, will be placed on antidepressants and second generation antipsychotics. While group therapy is not a good first treatment of choice, it might be helpful after there's individual work done. Even though the patient might frequently be silent, group therapy does provide valuable experience in practicing their interactions and getting important feedback from others. Let me give you an example here in just a moment of a schizoid individual. They have constructed sterile environments that they live in. So you've got the billionaire, eccentric Howard Hughes. He actually wouldn't even touch a spoon unless it was wrapped in tissues. His mother, when we talk about the genetic component, his mother was actually obsessed with germs and sickness as well. He was exceptionally intelligent. He did attend Rice University and dropped out of Rice University, so he was not a college graduate. He did instruct his staff to not speak to him or look at him. He was the only child. His mother was very doting. I mentioned her paranoia with germs and gave you an example of the spoon and eating utensils that his paranoia was aligned with. He was very introverted. He was psychosomatic. He had a psychosomatic adolescent paralysis at the age of 15 and was hospitalized for that, and they never found an actual physical reason for it. His mother died a year later after that psychosomatic paralysis, and then 2 years after that, His father died when he was 18. He did state that he had a goal to be the richest man alive. He was a very successful aviator and film producer out of Las Vegas. He had several episodes of serious aviation accidents that are known. He did have the tendency to have nervous breakdowns, and was reported that when he was at home, he would sit naked in a white leather chair. He had a tendency to repeat himself. He would sit alone in very darkened hotel rooms. He would burn his clothes if he felt that they had been contaminated. Um, and like I said, he would sit naked in the white chair, but he would be also found to sit with a cloth napkin over his groin, and he would place his feet inside tissue boxes. His story of his demise is a very sad one if you want to research that more. I will place a clip to a video for you within this PowerPoint that talks about him a little bit more. Okay, let's look at the next, which is signs of schizotypal personality disorder. These individuals present with behavior that is odd and eccentric, but does not compensate to the level of schizophrenia. Okay? It is marked by symptoms that look more like schizophrenia than do the schizoid personality. So they have difficulty making friends. They have a serious social anxiety and social awkwardness. They have a vague or odd speech. They typically have eccentric clothing and magical beliefs of things. They have a paranoia, very odd perceptions and emotions, and they have ideas of reference. Schizotypal personality disorder. The prevalence of this is very small, from 0.6 to 4.6% of the population. And more than one half of these individuals have had at least one episode of comorbid major depressive disorder. They are distinguished from those with schizophrenia by the absence of the psychosis that is seen with schizophrenia. So they have severe social and interpersonal deficits. They have anxiety when placed in social situations, which leads to a rambling conversation. They have some paranoia, suspiciousness, anxiety, and distrust. They have brief, intermittent episodes of hallucination or delusion. They can be made aware of their own odd beliefs, and they may be vulnerable to involvement with cults or unusual religious or occult groups. So schizotypal. They have social interpersonal deficits and a reduced capacity for the close relationship. They have these cognitive and perceptual distortions that don't align with each other. Their eccentric behavior does begin in early childhood. Magical thinking, again, I go back to that. Like they believe that they have telepathy, and that other individuals believe that they are telepathic and seek them out. They have these unusual perceptual experiences. I did talk about the odd speech. It can be like metaphorical. They are suspicious and paranoid. They have this really constricted affect. Again, the eccentric behavior. the social isolation and a lack of friendships because of that. I mentioned the excessive social anxiety, and this is due to the fact that they have a very negative self judgment. It resembles schizophrenia again, but it is absence of the psychosis that we see in schizophrenia. Schizotypal. This is just another resemblance to describe it. You'll see that it's very similar to the schizoid. They both have the social and interpersonal deficits and a reduced capacity for those close relationships, so those social bonds. They have the cognitive and perceptual distortions and this eccentric behavior that begins in early adulthood. They have this odd speech. Again, it resembles the schizophrenia. Okay, so how do we take care of individuals with schizotypal personality disorder? Nursing care, the guidelines that we need to follow are a respect for the patient's need for social isolation. We don't force them into situations where they're going to be very uncomfortable. So we have to be aware of and intervene appropriately when they have a high suspiciousness of individuals or you, the nurse, caregivers, and procedures, etc. We have to perform a careful diagnostic assessment for symptoms that might need intervention, for example, suicidal thoughts. So we need to assess carefully and ask the appropriate questions. We have to withhold our judgments and withhold our ridicule of these individuals. So how do we treat them? We give them supportive psychological care, and then we do need to investigate their possible involvement with any cults so that we can intervene appropriately. And then these individuals will be placed on low-dose antipsychotics. Okay, so let's remember here when we talk about cluster B or these erratic personality disorder cluster. This chapter is going to close by returning to the two most socially impacting cluster B disorders, the antisocial personality disorder and the borderline personality disorders. So they were not omitted here. Again, they will be covered at the end. But let's look at histrionic and narcissistic personality disorders. Okay. So again, the two most challenging cluster B disorders are the borderline and antisocial, and we will discuss these at the end of this chapter so that we can give a special focus to them. Okay, so let's look at a case study that I'm going to weave throughout the next couple of days. You've got Jim and Mercedes. They begin marriage counseling together in hopes that Mercedes says of saving their marriage. The therapist quickly notices that Jim seems to think a lot of himself while putting Meredith down. When she expresses hurt, he either laughs or manipulates her into feeling guilty or backing down. The therapist also notices that Jim frequently boasts about how successful he is, as if he needs the therapist to know and admire this about him. Okay. About 3% of the general population have antisocial personality disorder, and sometimes you will hear this referred to as psychopath. However, interesting enough, those who are imprisoned, it's prevalent in about 50% or more of those incarcerated. excuse me, these individuals will exploit and manipulate others for their own personal gain. They do disregard and violate the rights of others, and they do not conform to social norms. This is where the arrests come in. They are entitled. They feel they have a right to things that they don't particularly have a right to. They show deceitfulness, lying. They use aliases. They're very conning. They have an impulsiveness and an inability to plan ahead. So to set a plan for a week away, no. They show an impulsiveness and just do things. They're irritable, they're aggressive, and they get in repeated fights. They have a reckless disregard for themselves and for others. They are very irresponsible. They can't sustain work or relationships, and they have a lack of remorse for their behaviors. I do have a video clip here that you can go back and watch. It's approximately 6 minutes, which outlines this personality disorder in a different way. Okay, antisocial continued. They commonly have substance use identified as a comorbidity. They usually fail at, like I said, conforming to the law, sustaining consistent employment, and developing those stable relationships. And they exploit and manipulate others, and the reason that they do this is for their own personal gain. They're not often seen for this disorder specifically in the clinical setting, and if they are, it's usually only to avoid legal consequences. So perhaps this was a term of their parole or probation. Let's look at histrionic personality disorder. The prevalence of such is nearly 2% of the population, and the DSM-5 summarizes this disorder as a pervasive pattern of eccentric emotionality and attention seeking. They are excitable and dramatic, often very high functioning. They have very bold external behaviors, a limited ability to develop meaningful relationships. You see a pattern here. They're attention seeking, very self centered, and they have a very low frustration level. So it's very difficult to frustrate these individuals. They have very excessive emotions that may be provocative or smothering. They don't have insight into their own disorder or what role it plays in ruining relationships. So they are uncomfortable in situations which they are not the center of attention. And their interaction with others is often characterized by inappropriate, sexually seductive, or provocative behavior. They do display rapidly shifting and shallow expressions of emotion, and they consistently use their physical appearance to draw attention to themselves. So their style of speech is excessively impressionistic and it lacks in specific detail. They have self-dramatization and they have like a theatricality component to their behaviors and this exaggerated expression of emotion. They are suggestible, so they're easily influenced by others or others' circumstances. And they do consider relationships to be more intimate than they actually are. So this can cause a problem, say, if they're dating. Think about incessant texting or smothering of an individual. So how do we treat these? Psychotherapy, again, is the treatment of choice for these individuals. And how do we care for them? What are our guidelines as nurses? We need to know that the seductive behavior is a response to distress. So something is distressing them and they respond with a seductive behavior. We must keep our interactions very professional and ignore any flirtations that this individual may exhibit towards us. We have to model a very concrete language, so nothing eccentric, and help the patient to clarify what their inner feelings are. So, what is the inner feeling causing the distress that is leading to their behaviors? So, we have to teach and role model assertiveness for them. And again, it's important that we assess for suicidal ideation in these individuals. So let's continue on with the case study. As Jim and Meredith's marriage therapist continues to work with them, she quickly discerns that Jim is not interested in changing his attitude or behaviors towards his wife. Although Meredith, like Jim, is financially successful, Jim manages all their finances, and Meredith feels he exploits her income for his own advantage. Jim is hypersensitive to criticism and feels that as the smarter male partner, he is entitled to a greater share of control over their funds. All right, what is narcissistic personality disorder? It is an exaggerated sense of self-worth. They are hypersensitive to the evaluation of others. Although often it's grounded in grandiose distortions of reality, their mood is usually optimistic, relaxed, cheerful, and carefree. They do have that sense of entitlement and feel that they are more important than they are. So they have an exaggerated self-importance. They do lack empathy, and they have a tendency to exploit others to their own benefit. They have a very weak self-esteem, and they are hypersensitive to criticism. They have a constant need for admiration, again, why they're hypersensitive to any criticism. Less functional impairment is seen here than in other personality disorders. So let's look a little bit more at the narcissistic. I talked about this increased sense of self-importance. You could describe it as grandiose. So they exaggerate any achievements or talents, and they expect to be recognized as a superior without the commensurate achievements. They're preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. And they believe that he or she is special and unique and can only be understood by or should associate with others that have the same status as them. So they have that lack of empathy, and they're unwilling to recognize the feelings or needs of others. They are attention seeking. They are envious of others, and they do believe that others are envious of them. So overall, they show arrogant, haughty behaviors or attitudes. So let's look at the case study again. Jim is diagnosed with narcissistic personality disorder. Did you get that right? Given what you know about the characteristics of this disorder, what intervention strategies would you predict to be the most helpful in working with Jim? So that's a question that you need to think about as far as what are we going to do for the narcissistic personality disorder. Well, let's see. The guidelines for you as the nurse is that you need to remain neutral. You have to promote a stronger patient self-identity. avoid power struggles or becoming defensive with them, and you have to role model empathy. So, treatment. It is difficult to treat. Patients will not likely seek help or confront their shortcomings. Again, think about the unfolding case study that we discussed and the controlling behaviors that were seen. And did Jim have any idea to recognize his shortcomings or to confront them? So we use cognitive behavioral therapy, or CBT, to deconstruct their faulty thinking. And I will discuss CBT more in length for you. We can use some group therapy, but CBT seems to be more effective. And actually, these patients will be on lithium for their mood swings. So, folks, we're going to stop here with the recorded lecture, and we will continue further in class when I see you next week. So concentrate on the things that we went over today, and we will go further into personality disorders. We'll finish out the clusters. I'll finish out the cluster B, as I said, and cluster C, and then maybe not categorized as one. I'm going to discuss CBT with you, and we will talk a little bit more about your individual assignment. I will be opening that up, so I need you to take a look at your individual assignment, and I would encourage you to not procrastinate going ahead and trying to research that before you come to see me in class in case you have questions about it. There is an expectation for an APA formatted citation. You may have questions about that as well, and I've given you some resources if you look under Unit 3 resources to guide you in that, and the Surry Community College Library can also direct you towards how to do that correct citation. This will be an expectation moving forward, and it will be an expectation for you in 113. So I wanted to discuss it here and give you just a touch of that. So please look at your assignment and come to me with any questions. Good luck. Take a couple days to rest. It's well deserved, and I will see you soon.